I have Dr. Margret Duncan here with me. And Dr. Duncan, if you can just start, talk to me about what our health center offers and what that might look like for a potential patient.
Absolutely. Well, you mentioned the name, the Community Health Center. So really, we are an office that's taking care of all the way from newborns up to the elderly. We are a family practice office in general, and we're a place where some people who might fall through the cracks can find good care at our office. We participate with a lot of different insurances and have a sliding fee scale for patients who don't have insurance. We have a lot of bilingual staff and providers who speak Spanish, so we can provide that service as well.
It's wonderful. So something for the entire community, it
Yeah,
sounds
exactly.
like. Talk to me about, we've been discussing COVID, particularly long haul COVID. Tell me about what you all have been experiencing at the health center, maybe kind of a broader perspective of where we are in our area.
Sure, absolutely. I know we all wish this was over, and it's not. And we have certainly seen in our patients complications of COVID. People know of the severe complications, the hospitalizations. We've had patients who have had serious blood clots, pulmonary emboli. But we've also seen a lot of what has now been called long haulers. People who have had symptoms from COVID, they weren't terribly sick. They're not terribly sick people, but they continue to have symptoms, headaches, fatigue, shortness of breath, some still toting oxygen tanks for a little bit that you would never expect would need that. And so that's been, hard to watch, where people are having long, and when we say long, we mean months of symptoms left over from COVID.
I know you see a lot of children at the health center. What has COVID looked like for the children that you all have seen?
It's a great question. In general, COVID acts a lot like any other cold virus. And so because of that, people may not realize the significance of COVID in children. It is happening. We are seeing cases. And so we would just start by encouraging people to still be thinking in terms of prevention. That can look like trying to gather outdoors if there's a big group gathering, and vaccinations for kids down to 6 months are available. But also just suspecting COVID. If their kids have cold symptoms, think COVID, even though it's acting like a cold. Have home tests in stock so that if kids develop symptoms, they can be tested right away. If it is COVID, to actually think about protecting the community by truly following the recommendations to isolate. And even if it's not COVID, thinking about how that virus that might look like COVID, to try to prevent that from spreading in the community, because every virus could look like COVID and require testing and missed work and missed school. So just being cognizant of that.
You were starting to talk about vaccines a little bit. Can you talk about what you all are seeing in adults? I understand for those unvaccinated, it may prolong some of these symptoms.
Absolutely. There has been a dramatic difference in the rate of long-term symptoms in patients who are vaccinated versus unvaccinated, definitely much higher in the unvaccinated population. In addition, the serious complications, much higher in unvaccinated. And so we really believe, thankfully the vaccine's been out now for quite a while, and so we do believe that it provides a significant protection against severe COVID. Yes, we know that some people who are vaccinated are still getting COVID, but it tends to be mild, so.
What about women who are pregnant? I know in the very beginning there was some concerns about getting vaccinated if you were pregnant. Can you tell me where we're at with that?
Sure, absolutely. So we totally understand why people were reluctant to be vaccinated when pregnant. Absolutely, it was new. Thankfully now we've had it out for quite some time, and thus far there does not appear to be any increased risk to those pregnant women or to their unborn children with that vaccine. On the flip side, there is an increased risk in complications getting COVID while pregnant. There's an increased risk for preterm labor, for preeclampsia, a complication of pregnancy that can be dangerous both to the mom and to the baby.
I know we've been experiencing COVID for a couple of years now, and I anticipate it continuing for a bit here. Can you talk about just being cognizant of the vaccinations? I know we were mentioning that our bodies become immune to some of these things, and what we can do to help keep our community safe.
Absolutely. Unfortunately, both with natural immunity, a lot of people have had COVID, and with the vaccine, that immunity fades over time. And so we can't bank on previous infections or vaccinations. We need to take to heart the recommendation for boosters if that fits. And I would just encourage people, things are constantly changing in recommendations. Talk with your doctor. We're happy to have conversations about this, to work with patients to come up with individual recommendations for their situation.
Thank you, Dr. Duncan.
Absolutely.